Hi, Dr. Happy here. Most parents are mostly worried about their kids' malalignment of the tooth, that mainly due to crowding, spacing, missing teeth, and improperly placed tooth. The main causes of this is the use of pacifier for more than 3 years, prolonged use of the bottle feeding, then some habits like mouth breathing, tongue thrusting, and congenital problems, and hormonal imbalance, genetic issues, injuries of the jaws, and cleft lip, cleft palate. And Because of these, sometimes the kids may have a small jaw, and the teeth will be very bigger, larger, and vice versa. In case of crowding, you can see the jaw size is small and the teeth will be normal or larger. And in the case of spacing, you can see the jaws will be bigger but the teeth size will be small. That causes the spacing in between the tooth. And sometimes impacted tooth, atypically shaped tooth, we used to call pectilaterals. Sometimes the teeth will be very small, congenitally missing will be there, and impacted tooths also will lead to missing tooth, and there will be more space, and the teeth can erupt in other than the jaw, like inside the palate, or lingually tilted tooths. And if you are extracting the deciduous tooth area, so what will happen, the nearby tooths will drift towards the space, so that the permanent tooth won't get enough space to come into the normal position, so it can erupt in another place. And early removal of this deciduous tooth also cause the cessation of the jaw growth. Arch length will get reduced because of that, so that the teeth won't get enough space, so it will erupt in improper place. So all these reasons can lead to, and in same case it's happening in the spacing also, all these reasons can lead to the malalignment of the teeth. So what's a concern when it comes to the oral health? So in these cases, the kids cannot brush their teeth properly, because however they brush, the food gets accumulated in between the two teeth, and they cannot clean it properly. They cannot maintain a good oral hygiene. So a lot of food will stuck in between the two teeth, and that will lead to the bad breath and improper and the lot of plaque and calculus. So that in turn will lead to periodontitis, and the enamels also, you can see some whitish patches in between the enamels, and the enamels are more prone to dental decay too. And there will be occlusal problems. The kids won't get a proper occlusal bites, they cannot have the normal occlusal between the upper and the lower teeth. That also will lead to periodontitis, gingival inflammation, and underlying bone loss, etc. And at the same time, the most concern according to the kids is it's not aesthetically pleasing, so they will be worried about that. So in such cases, what we can do, the early diagnosis is the main thing to prevent this. So when the kids in the kid stage, you can maximum try to save the deciduous tooth, and wait for the time for the maintain it till the permanent tooth erupts in the oral cavity. And even if you remove it earlier, you can go for the space maintainer, so that the space will get maintained, so that the normal tooth can erupt in the normal place. As well as if you later on, you can just get the consent from the doctor, like dentist, what options are available, and then you can go for that. You can go for braces, and even if you can go for veneers, crowns, and bridges. So all these options are available, but whatever options are available later, you just focus on the prevention. So in the earlier kid stage itself, you have to focus to maintain the space by restoring the natural deciduous tooth. Maximum, you try to save the tooth. If you extract the tooth, maintain it by the space maintainer, and later on, if it leads to crowding or spacing or any tooth is missing, you can just identify the teeth is inside the jaw or not. If it is inside the jaw, you can just go for the ortho treatment so that you can bring the teeth out into the jaw oral cavity and maintain a good occlusion. I hope this video is useful. Please like, share and subscribe. Thank you.